Now, Ghana has set a 2-year target to set up a manufacturing plant for vaccine production. The country will require $200 million in the next 10 years to produce domestic vaccine for viral diseases. President Akufo-Addo a few months ago set up the National Vaccine Institute to develop the framework to guide the implementation of that plan. At a meeting to update on progress of work done, Chairman of that committee, Professor Kwabena Frimpong-Boateng, says there is support from the private sector for the project.
As we said, within the first 2 years, we'll have one financial partnership in place to support our objectives.
Now, the chairman of the Ghana COVID-19 response team, Dr. Nefia Samuaban, says government is facilitating discussions with manufacturers of some of the COVID-19 vaccines to enable local pharmaceutical companies copy and produce it here under a fill and finish initiative.
We are trying to resolve two problems. One, there are already known vaccines, like AstraZeneca, like Pfizer. They are already, the testing has been done, the research has been done, the vaccine is in use. And we want to be able to copy it in Ghana. In order to do that, you need government's intervention to facilitate discussion between the original owners so that the private sector can be allowed to copy. So that is one of the big areas that this institute is going to help. How do we copy vaccines that are already known? Then the second problem we're trying to address is more for the future. How do we develop the capacity to do our own research, discover our own vaccines for future diseases? So those are two different, and that is where the research institutions needs to be supported on a sustained basis for a number of years, so that this time is COVID. 10 years' time is another. By that time, we have people who have been working on different vaccines so that one of them can be used. So I just wanted to clarify there are those two issues. The first is copying something that is already known, Pfizer vaccines or polio vaccines. All this we import. So it's like assembling a car. We're establishing an assembly plant here. We have strong pharmaceutical industries, but they produce medicines, not vaccines. And producing vaccines and medicines are like producing cars and airplanes. They are not the same. All right, so that is the first problem we want to address. The second problem is how do we get to the stage where when we get a new disease, our research institutions are already been working on some type of vaccines that can be tested and used for these purposes. So there are two different processes. And this institute is going to make sure that those things happen. But the institute itself will not produce vaccines.
Meanwhile, the Ghana Health Service will from Tuesday begin administering another set of AstraZeneca vaccines. This follows the successful completion of inoculating Ghanaians with the Johnson & Johnson vaccines. Programs Manager, Expanded Program on Immunization at the Ghana Health Service, Dr. Kwame Amponsah-Chiano, has been telling Israel Live more about the vaccine rollout plan on the AM show.
Tuesday, we'll start from Tuesday. We had hoped we were going to start this week, but the preparations were quite enormous. So come Tuesday, we'll start.
All right, so what's the plan?
Okay, so the plan is we are doing what we call equitable distribution. Remember, we have some backlog of Ghanaians who took the first shot and are waiting the second shot. If you will recall, the last time we did a second dose en masse, we started from 1st March, those who had received the vaccine from 1st March to 9th March. I don't know if you remember this.
Yes.
Yes, so in epidemic control, you normally want to protect the most vulnerable. Then, of course, you go to those who are stronger and so on until everybody is covered. And so when we started the rollout, we looked at some population segmentations where we targeted health workers, frontline persons, and security people, people who are above 60 years and older, and then also people with underlying conditions.
All right.
But we have the date, the date of vaccination and all that. That's why when we're doing the second dose, we targeted those who had received from 1st to 9th month. So for this exercise, we're doing some parts of the health workers as well as of the general population, the general vulnerable population.
All right.
So we've done some equitable distribution to health workers across the nation. And then, of course, we would then also continue with from where we left off, with those who would have received the vaccine, the first dose from 10th to 29th month.
All right.
And then we still have AstraZeneca in the pipeline. And so by middle of September, we would have covered all the rest of the people. So
Dr. Achiano there, who is head of the vaccination exercise at the Ghana Health Service.